AIDS, or acquired immune deficiency syndrome, is a serious condition that weakens the body's immune system. This makes it harder for the body to fight off infections and diseases. The virus responsible for AIDS is called HIV, or human immunodeficiency virus. HIV attacks specific cells in the immune system, known as CD4 cells, which are crucial for fighting off infections. Over time, HIV can destroy so many of these cells that the body becomes highly vulnerable to opportunistic infections. Leukopenia, on the other hand, is a condition characterized by a low white blood cell count. White blood cells are an essential part of the immune system, acting as the body's defense against infections. These cells normally circulate in the blood and are designed to identify and destroy harmful invaders like bacteria, viruses, and fungi. When the white blood cell count is too low, the body's ability to combat infections is significantly compromised. It's important to understand that AIDS and leukopenia are closely interconnected. HIV infection can lead to leukopenia because the virus destroys the very cells responsible for producing white blood cells. This makes individuals with AIDS more susceptible to developing leukopenia and experiencing its associated complications. Therefore, understanding both conditions is crucial for effective management and prevention. Diagnosing AIDS and leukopenia involves different tests, but often go hand in hand due to their close relationship. For AIDS, the primary test is an HIV antibody test. This test looks for the presence of antibodies, which are proteins produced by the body in response to HIV infection. These tests can be conducted using blood or oral fluid samples, and some tests can provide results in as little as 20 minutes. Diagnosing leukopenia involves a blood test called a complete blood count, or CBC. This test measures the number of different cell types in the blood, including white blood cells. If the white blood cell count is significantly lower than normal, it indicates leukopenia. Early diagnosis is crucial for both AIDS and leukopenia. For AIDS, early diagnosis allows individuals to start antiretroviral therapy, or ART, sooner, which can significantly slow the progression of the disease and improve life expectancy. In the case of leukopenia, early detection allows for timely intervention and management of the underlying cause, reducing the risk of serious infections. Therefore, regular testing and medical checkups are essential, especially for individuals at risk of HIV infection or those experiencing symptoms suggestive of either condition. Recognizing the symptoms of AIDS and leukopenia is crucial for early detection and intervention. However, both conditions can be silent in their early stages, making diagnosis challenging. Initial symptoms of AIDS can be mild and flu-like, including fever, sore throat, rash, and fatigue. As the disease progresses and the immune system weakens, individuals may experience persistent fever, night sweats, weight loss, diarrhea, and swollen lymph nodes. Leukopenia itself often doesn't cause specific symptoms. Instead, the symptoms are related to the body's weakened ability to fight infections. Individuals with leukopenia may experience frequent infections, slow wound healing, mouth sores, and fatigue. The challenge lies in the fact that these symptoms can be indicative of many other conditions, making self-diagnosis unreliable. Therefore, it's crucial to consult a healthcare professional for proper evaluation and diagnosis if you experience any of these symptoms, especially if you belong to a high-risk group for HIV infection. While there's no cure for AIDS, advancements in treatment have significantly improved the lives of people living with the virus. Antiretroviral therapy, or ART, is the cornerstone of AIDS treatment. ART involves taking a combination of medications daily to suppress the replication of HIV in the body. This helps to restore and preserve immune function, significantly reducing the risk of opportunistic infections and AIDS-related complications. Treatment for leukopenia focuses on addressing the underlying cause. If leukopenia is a side effect of medication, adjusting the dosage or switching to a different medication might be necessary. In cases where leukopenia is caused by an autoimmune disorder, medications that suppress the immune system might be prescribed. For individuals with AIDS-related leukopenia, managing both conditions is crucial. RT plays a vital role in boosting the immune system, which can help improve white blood cell count. In some cases, medications that stimulate white blood cell production, known as granulocyte colony stimulating factors, or GCSFs, might be used to treat leukopenia. It's important to note that treatment for both AIDS and leukopenia should be individualized and tailored to the specific needs of the patient. Regular monitoring and follow-up with a healthcare provider are essential to assess treatment effectiveness and make necessary adjustments. Section 5. Prevention is key safeguarding against AIDS and leukopenia. Preventing AIDS is crucial as it directly impacts the likelihood of developing leukopenia. HIV transmission primarily occurs through unprotected sexual contact, sharing needles, and from mother to child during pregnancy, childbirth, or breastfeeding. There are several effective ways to prevent HIV infection. Using condoms consistently during sexual activity is one of the most effective ways to prevent HIV transmission. For individuals at high risk of HIV infection, pre-exposure prophylaxis, or PrEP, is a medication that can, significantly reduce the risk of contracting the virus. PrEP involves taking a daily pill to prevent HIV from establishing infection. Furthermore, getting tested regularly for HIV and knowing your status is crucial for prevention and early intervention. Early diagnosis and treatment not only benefit the individual but also help prevent further transmission of the virus. While preventing leukopenia directly might not always be possible, especially when it's caused by other medical conditions or treatments, preventing AIDS significantly reduces the risk of developing this complication. Section 6. The interplay how AIDS treatment affects leukopenia. The relationship between AIDS treatment and leukopenia is complex. While AIDS itself can cause leukopenia, some medications used to treat AIDS can also contribute to a low white blood cell count. This highlights the delicate balance that needs to be maintained when treating both conditions. Antiretroviral therapy, or ART, while effective in suppressing HIV, can sometimes lead to bone marrow suppression. Bone marrow is the spongy tissue inside bones responsible for producing blood cells, including white blood cells. When bone marrow function is suppressed, it can result in a decrease in white blood cell production, leading to leukopenia. Healthcare providers carefully monitor individuals on RT for signs of leukopenia and other blood cell abnormalities. Regular blood tests are essential to track white blood cell counts and make necessary adjustments to treatment regimens. In some cases, adjusting the dosage or type of RT medication might be necessary to manage leukopenia while continuing to effectively suppress HIV. Individuals navigate the challenges, maintain their quality of life, and live full and meaningful lives. Section 8. The future of AIDS and leukopenia research and advancements. The landscape of AIDS and leukopenia treatment and prevention is constantly evolving thanks to ongoing research and scientific advancements. Scientists are working tirelessly to develop new and improved treatments for HIV, aiming for a cure. Gene editing technologies, therapeutic vaccines, and novel antiretroviral drugs are among the promising areas of research that hold hope for the future. Furthermore, research is ongoing to better understand the complexities of leukopenia, particularly in the context of AIDS. Scientists are exploring new approaches to stimulate white blood cell production and enhance immune function in individuals with compromised immune systems. These advancements offer hope for more effective treatments, improved quality of life for individuals living with AIDS and leukopenia, and ultimately, a future where these conditions are no longer a significant threat to global health. Section 9. Conclusion, a call to action, prevention, awareness, and support. AIDS and leukopenia are interconnected conditions that underscore the importance of a robust immune system. While advancements in treatment have transformed the lives of people living with AIDS, prevention remains the most effective strategy in combating both conditions. By understanding the roots of HIV transmission and adopting preventive measures like condom use and PrEP, we can significantly reduce the incidence of AIDS and its associated complications like leukopenia. Early detection through regular testing is crucial for timely intervention and better health outcomes. Furthermore, supporting research efforts, raising awareness, and combating stigma are essential steps in our collective fight against AIDS and leukopenia. By working together, we can create a future where these conditions are no longer a threat to global health and well-being.